All right, hello everybody, this is Jeff, and it's actually been now 10 years since I've been employed as a nurse. So I figured I'd take this time to talk to you guys about nursing, what it is, maybe talk to you about it in case you're contemplating going into nursing school, or maybe you are in nursing school, or maybe you just kind of want to get insight into somebody else's profession. I figure I can go through and talk to you about some of the common things people ask about, my trajectory and career path through nursing, and what I've learned in the past 10 years. Now myself, unlike some traditional nursing students, I was a second degree nursing student. So that means that I already had another bachelor's degree and then I applied to a second degree program. And that's how I got into nursing. So for me, it was a career change. I formerly was a computer engineer. I had a master's degree in IT, and then I took the step and pursued going to nursing school. Second degree programs are different than traditional programs. They're substantially shorter, anywhere between 12 and 24 months I've seen. My particular program was 16 months. I did apply for one of the 12-month programs, but I ended up ultimately making the choice to go to where I did, which was a 16-month program. And I will tell you, 16 is the middle ground for second degree programs, and I almost thought that that was too quick. It was a lot to learn in a very short time frame, but I did make it through, obviously, because I've been celebrating my 10th year as a nurse right now. The other thing about the second degree programs is that they culminate with a bachelor's degree, so a BSN in nursing. And I guess BSN in nursing is redundant, so it's a BSN, which means a Bachelor's of Science in Nursing, versus the traditional route. You can either go the ADN or the BSN, which is the associate's degree in nursing, or again, a Bachelor's of Science in Nursing. Or there is, I've now found out about a BA in nursing, so a BAN, so it's a Bachelor's of Arts in Nursing. Those are few and far between, but they do exist out there. So if you're taking a traditional route, you're gonna go through a 4-year college. Traditional BSN, a lot of times it actually takes about 5 years to get that degree just because of the classes that are involved. But again, in my case, it was a 16-month second degree bachelor's program. I'm not going to talk about the competitiveness of actually getting into a nursing school because I'm honestly not sure how that stands anymore. I don't know if in the current state it is an extremely competitive program. I know when I was looking for it originally, it was very competitive to get in. Part of that was because the time frame I decided to make a career change was when unemployment was at an all-time high. So a lot of people were going and looking for different professions and degrees to pursue when they were unemployed. So nursing was a very obvious choice to a lot of people because anybody can get into it, anybody can start it, and there's lots of programs out there. So I know when I applied, there was a lot of rolling wait lists and things like that happened back in Michigan, where I'm originally from, versus there were fewer programs that you could actually apply per semester, and they would just grant people in based on each semester. Like I said, second degree programs usually where you apply every time they offer a starting date and you either get in or don't and you can apply again the next term. A lot of the traditional programs where I was from, you got put on what was called a wait list, and it was a rolling wait list. So I'd apply, I'd be accepted, I'd be spot number 645. It might be 2 years, it might be 3 years, it might be 5 years before my spot comes up. But I do know a lot of students who went through that route back in my home state. I moved from Michigan to Washington, D.C. to attend Georgetown University is where I went to my second degree program at, and it was different. It was you applied, you either got in or you didn't get in. And I was lucky enough to get in the first time I applied. So that's all I can say about that. I don't know how competitive it is now, so I can't really talk about the nature of that. But to school itself, nursing school was hard. It might not be the same for you. It was really hard for me. Like I said, I was a second degree student. I already had 2 degrees, so technically it was my 3rd degree. So I was a 3rd degree student. They don't call it that. But I already had 2 degrees. I had a bachelor's degree in computer engineering, and I had a master's degree in information technology. And going back to get this nursing degree was the hardest thing that I have ever done. I don't know if it was because it was just a different way of thinking about things. I just wasn't used to that type of environment. I wasn't used to where you had all day of classes and clinicals all crushed into such a small time frame. And I really didn't get the hang of it until my second, maybe my 3rd semester. Granted, it was only a 4-semester program for me too, so that was stretching it pretty far to get into the studies, but I finally did get into it. I will tell you, the second degree programs and nursing in general usually goes on a different grading system. The grading system itself might be the same, so like a 70 is still going to be a C-, an 80 is still going to be a B-, but a lot of nursing programs say, we're going to hold our students to higher standards. 70 is traditionally passing. We're going to make it so a 74 is what your passing grade needs to be. Or some other places I've heard as high as 80 is what a passing score is. If you get a 79, you fail. My particular program, 74. You had to get a 74 in all of your nursing classes. Not only did you have to get a 74 in the class itself, you had to have a cumulative test score of 74. Meaning I could have all my other assignments turned in, anything to do with my clinical, if they graded it together or not. It depended on the class, whether that grade was rolled in or if it was considered a separate class. I could technically be sitting there with a 90%, but I've gotten a test average below a 74, you're gonna fail. It's just the way it is. You have to know your program when you go into it, and you have to know what you're in for to know if you're going to struggle with just the test grades or in general with just getting the grade. I almost failed out my first semester. My first semester, I had 2 classes that I literally squoze by with a 74%. 2 of my classes in my very first semester, I passed by, literally I was on the line of whether I was going to pass or not. I almost failed out and I almost quit. I realized it was so much harder and so much different than I thought it was going to be that I made a mental note to myself halfway through my first semester when I knew I was struggling in some classes. I said, look, self, if you don't pass this semester, maybe nursing is not for you. I'm not saying that that is the way to go. We did have some students in my cohort that failed one of the classes their first semester or 2 of the classes their first semester. They got rolled back into a previous cohort because just because you fail once doesn't mean you're out. You get a chance to retake. And I mean retake, they had to take the whole class again. They had to step back an entire semester. You don't get a chance to just pass that class. You have to go take it again. But 2 students that I know of that failed 1 or more classes that first semester, and then were successful the second time around and are nurses today. So I'm not saying that if you fail, you should have the same mindset I did, but I was kind of like burned out. I had already left from a job that I didn't like, which is why I was pursuing a second degree. And then I got burned out in my first semester of nursing school just because it was so mentally challenging for me. It was so different than what I had done before. But I did. I luckily passed and ended up in my second semester. I met a great group of people who became my study partners, my big study group. And that is a tip for anybody going to nursing school. Get a study group. Find people that have your same thought process that you think you can work well with, and get with those people because they are going to help you through your career. I would not have made it without my study group. My study group, not only did they, kick me in the ass to study right before a test when I needed to, but we would get together and we'd talk about things, and I'd realize I understood something completely incorrectly, and they would correct me and tell me, no, this is what it is. Or they'd even just give you tips. I'd say, I'm really struggling in this area and I don't understand. And I had some people say, hey, think about it this way. Oh, wow, that really makes sense. So having a group of people that to study with, that you really get along with, that can really significantly help you. So if you're in nursing school and you're struggling, my suggestion is try to find some people that you can work with because they will really help you through. So nursing school itself, there's not much else to talk about. It was hard. You have to really balance your time, really balance your life, really balance your energy, and buckle down and get through it. Luckily, my program was full-time. I can't say luckily because some people might not want a full-time program. When I took it, it was full-time. So my focus was on nursing school. The hard part about that is that means I didn't have a job. I didn't have any other income coming in. I also didn't have a family at the time. So I was a single guy. Nobody else was relying on me for anything. So I was able to focus all that time and energy into my studies to get through. Everybody might not be that lucky. If you have a family you're supporting, you clearly are not going to be able to as easily take a year, 12 months, 16 months, 18 months, whatever it is off of work in order to fulfill it. Just get through the best you can. You're going to know what's best for you and how you can best get through based on your life situation. Well, once you graduate nursing, you're not a nurse yet. You have a nursing degree, but you still have to take a standardized test that's called the NCLEX exam. And the NCLEX exam is some computer adaptive test that you can get anywhere from 75 to 265 questions on that exam. And it bases how you answer one question on if you go up to the next level of difficulty, or if you have to answer more questions at that difficulty, or if you have to drop down to another difficulty level. So it's one of those tests that it freaks people out because it's very difficult to study for, and I'll tell you, it was not easy. I can't say it was that hard either, but it's not because, I'm not saying it was not hard because I went in and I was like, oh, I studied, I know these answers. A lot of that exam is knowing how to take an exam. There's knowledge, sure, but there's also exam taking techniques and test taking techniques. I would highly suggest, if you are going to take the NCLEX anytime soon, and if this is something that scares you, don't necessarily just go through and focus on content, because that's not going to get you all the way there. Learn how to take a test. It's a sad truth in the industry of the standardized testing and computer adaptive testing that learning how to test is a big part of passing those tests. It's not the greatest system in the world. I didn't say I like it, but I'm giving you hints. If you want to get through, really look at test taking strategies. And I'll tell you, the NCLEX was a computer adaptive exam, like I said. My National Registry EMT, which I took afterwards, was the exact same setup, the exact same scenario, actually at the same testing center, but a different test, still a computer adaptive test. And those test taking skills helped me with that as well. And then when I got my nursing informatics certification, that wasn't computer adaptive, that was actually just standardized. Like when you hit the button, it randomly gave you all the questions it was going to give you. You could actually go back in that one, which you can't do in a computer adaptive test. Like you can't go back and rechange an answer because you thought about it later. You can in the nursing informatics one, but still, the same concept was test taking strategies really helped me get through that exam. So once you finally pass the NCLEX, you are a nurse. You have a license in whatever state you are. Yay, we're a nurse. I will tell you, when you get to your first nursing job, you're going to realize that you don't know anything. And that is something you have to come to grips with. If you've ever seen Scrubs, the TV show Scrubs, John Dorian, the doctor, his first day as a doctor, one of the things he says in that initial episode is, I realize that I don't know jack. And it's absolutely true. It's true to have that feeling, I should say. You know a lot. You've learned a lot from school. You've learned a lot of content. The actual practical application of it, even though you've done clinicals, it's a whole different ballgame, especially for somebody like me. I started nursing in the emergency department. I had one shadow day in the emergency department all through my nursing school. Everything they teach you in nursing school is catered toward your standard med-surg bedside nurse, is pretty much what your clinicals are based on. Emergency department is a whole different ballgame. I remember at my initial midpoint evaluation for our orientation program. So our orientation for being a nurse was 12 weeks. I got 12 weeks of orientation to see if you're gonna cut it and are you gonna be cut loose to be on your own. 6 weeks in, we had the midterm evaluation with our director, with our preceptor. I went in there absolutely waiting for them to say, Jeff, you're just not gonna make it. You're not cutting it. You're not learning fast enough. Because I didn't feel that I knew anything. There was just so much information coming to me from all angles. I was going home after a shift and just feverishly studying online, of looking things up and be like, what did I miss? What don't I understand? Like, how does this disease process work? What was I supposed to do in this situation? I just felt lost. And I get to that midterm evaluation and the director and the preceptor, they're like, you are right on target. And I was baffled. I was like, excuse me? And I even talked to them about it. And I said, are you sure? And they're like, yeah, you are exactly right on target where we expect you to be at this point. And I said, I don't feel like I'm on target at all. And their response was, yeah, most people don't. The fact that you don't feel like you're on target, or that you have concerns and questions and aren't sitting there and cocky about I know everything, shows me that you're gonna make it and you're gonna be a good nurse. And I was baffled. And it was truly one of those things where even after I got off of orientation, I remember that first shift by myself. Myself and one of the girls I went to nursing school with, we both worked in the same emergency department together. We both came off of orientation the same day, and her and I said that after that day, we worked together that first shift when we were by ourselves, and she said, we're going out for drinks after this because we need to celebrate that we've made it. And we went out for drinks and we still talked about it, that feeling of helplessness, knowing we had people to count on, but it was just, you don't feel like you know everything. And you don't know everything. You never know everything. It's always a learning process. But we really did undersell ourselves. We cut ourselves short in a lot of areas because we really were good nurses who knew what we were doing. It's just getting used to it and getting used to being in charge. So you're going to have that fear when you graduate and when you start your career. If you're in the position right now where you're just starting your first nursing career and you feel like, I just am not getting this, it doesn't mean that you're not getting it. It could. Some people just don't make it. They don't cut it. My class had 10 people that started. Only 8 of us made it through. One person quit about 6 weeks in because she just said, this is not for me. The emergency department nursing is not for me. I don't get it. I'm not making it. And that's okay. That happens. But don't sell yourself short. Or when you do feel like you're not getting it, it doesn't mean you're not. Just sit back, breathe, relax. See how your preceptor thinks you're doing. See how your director thinks you're doing. One day, I will tell you, it just clicked. One day, things will just click. Nothing will change from the day before to that day, but all of a sudden you'll just realize like, wow, I really do know what I'm doing. Like, of course you're gonna come into situations where you need help with. Of course you're gonna come into situations that you've never dealt with before. Just because you have orientation for 6 weeks doesn't mean you deal with every possible disease process or every possible person that could walk in that door in that orientation time frame. So don't worry, you'll get through as long as you keep studying, keep learning, and never pretending that you already know everything. You're gonna make it, you're gonna be fine. Let's talk about the nursing lifestyle for a minute. Depending on where you work, what type of department you're in, and what hospital you're at, depending on how they do things, there's traditionally some shifts that nurses have. I'm talking more from the hospital nursing setting, not the outpatient setting, because I've never worked in the outpatient setting. Could be the inpatient, could be the emergency department, whatnot. But most hospitals either have 3 12s, 2 12s and 2 8s, or 5 8s. I think 3 12s is pretty typical out there now, and 3 12s is great because 3 12s is only 36 hours, but most facilities will consider that a 0.9 FTE, they call it, so it's a 0.9 full-time equivalent. So working only 36 hours, you are considered a full-time employee, you have access to all the full-time benefits, but you only work 36 hours a week. You only work minimum of 36 hours a week, I should say. And 3 12s might sound like a lot. 12-hour shifts are long and hard. But when you weigh that against 3 days I go to work and 4 days of the week I have off, it is an amazing lifestyle if you make it an amazing lifestyle. Scheduling is a different thing because sometimes if I get my 3 12s together and work 1, 2, 3 days in a row, it's great and terrible at the same time. That third 12-hour shift, you are going to be dragging so slowly just because it's hard work being on your feet, actual having physical activity, moving people around, cleaning up, God knows what. It's just difficult work. So that third 12, you're usually pretty wiped out. But think if you stack your 3 days a week together, that means you can stack your 4 days off together and you get a 4-day weekend every week if you do it right. Some people prefer to have like a day in between some of their shifts. They'll do like 2 and then have a day off and then do 1, and that's a pretty good lifestyle as well. Some people get scheduled every other day, and that I will say is the worst one in my opinion. That was the worst way to do it, because if I worked like on Monday, had Tuesday off, I worked Wednesday, had Thursday off, I worked Friday, I just felt like you couldn't do anything. It was just a weird work week to deal with like that. I'm sure from you people who are traditionally out there working Monday through Friday, 9 to 5, you're gonna say, if I had 2 days in the middle off, that would be fantastic. It's just a different lifestyle. So hear me out, because with the nursing profession also, keep in mind, you're not necessarily just working day shift. Letting the ambulance go by outside. In the nursing profession, you're not just working day shift necessarily. You might be working day shift, you might be working evening shift, you might be working night shift, or you might be on a rotating schedule of any of those. And in my facility, when you started, everybody starts rotation. The rotations, it's interesting because the way ours was you had to work 50% of your shifts have to be off shift. And if you're standard rotating, it was only days and nights. You didn't really have the evening option unless you picked up a shift. So we had 7A to 7P or 7P to 7A as a standard rotator. You could also end up getting some day evening rotation shifts, which means you either work 7A to 7P or 10A to 10P or 11A to 11P or 12A to 12P. And anything other than that 7A to 7P shift was considered your off shift if you had a day evening rotation. There's a couple days only spots that exist that people work only 7A to 7P at all times, but those are usually for the higher level, higher seniority employees that are out there. Like I said, when I first started, it was 7A to 7P or 7P to 7A. Doesn't sound bad. A 6-week nursing schedule is typical. You get your schedule I can't say 6 weeks in advance. You get it in advance and it's for 6 weeks. So you'll at least know, you'll get it 2 weeks in advance usually and have it for 6 weeks. So theoretically I know what I'm doing 8 weeks from now, but I don't necessarily know what I'm doing 2 weeks from now, depending on when you're at and when the schedule posts. But it was nice to be able to plan, but sometimes working that 7A to 7P 1 week and then 7P to 7A the next week, that rotating back and forth between day shift and night shift was a killer for me. It was so difficult to rearrange your life, especially when sometimes it would be, I would end a week on a Saturday working a 7A to 7P shift on Saturday. And I'd be on the next week, they'd put me on the Sunday schedule, starting my night shift. So the next Sunday I was there, the following day I was there for 7P to 7A. So I had literally 24 hours off to somehow swap my whole routine to be night shift. And that was tough. The switching between the day shift and the night shift can get very tough. I will say I enjoy it to an extent, but the first chance I got, I actually took a nights only position. And I'll tell you why. There's something in the nursing profession called shift differential, and shift differential is fantastic. 7A to 7P shift doesn't pay you any differential. Evening shift usually at some places will pay some sort of differential, and night shift pays usually a higher differential. When I first started, and it's not like this anymore, it's because the union contract has changed. I work in a facility that has a union. My particular hospital did 7A to 7P was just your standard pay. If you worked a night shift because you were a rotating shift person, when you worked night shift, you got 15% salary increase when you worked night shifts. That was fantastic. 15% is huge. It is great. Because we're talking, I made, let's round it out to about $30 an hour when I started. So 15% of $30 an hour is what, $4.50 I would get when I was working a night shift. You get an extra $4.50 just for working night shift. But they had a clause in our contract, whereas if you went night shift only, because it was so undesirable, quote unquote undesirable for people to do night shift only, it was a 25% shift differential when you worked night shift if you were night shift only. And I say when you worked night shift because you could pick up overtime on the day shift if you wanted to. You didn't get any differential for that. You were back to zero. So your standard schedule was working night shift and you always got 25% for working the night shift. So I immediately, after my first year in nursing, essentially got a 25% raise because I went to a night shift only position. And I'll tell you, some people were sneaky. There were some people in there they only liked working day shift. And they would try to tell you when they were brand new, like, oh, I heard that you like working night shift. Instead of taking a night shift only job, how about I'm a rotator, I can't get a day shift only position. You're a rotator right now, you don't have a night shift only position. How about we just you swap all your days to me and I'll swap all my nights to you? Because you were allowed to do shift swaps. So essentially somebody who wanted to only work day shift but was a rotator could only work day shift if they swapped all their night shifts with somebody else. Sure. They were preying on the fact that you didn't understand the money you'd be missing out on. Because if I did that, I was losing out on 10% shift differential by not having a night shift only position. I'll tell you, it's changed. My contract has changed. Now it's a flat rate differential, no matter if you're a nighttime only position or a days only position or a rotating position. It's all the same flat rate. So it would actually work now. And it's much lower. It's unfortunate because that went away. But it was, the 25% was fantastic. And I'll tell you, night shift lifestyle, it's not for everybody. At the time, it was perfect for me. Not only was I only working 3 days a week, so I'm only working 3 night shifts, and you usually would, if you stack your days together, you take about 1 day to kind of like recover, and then you kind of go back to day shift normalcy for your other days that you were off of the week. But it was fantastic because even sometimes I wouldn't swap my shifts and I would just sleep during the day on my days off and be up and be a night owl and, either go out to the bars and the clubs. I didn't really do that as much, but I could have. But I do, more, computer stuff, video games, this, that, the other. I'll tell you, if you can find a 24-hour grocery store, go shopping at 2 o'clock in the morning. You have the place to yourself. It is the most wonderful thing to not have to deal with other people at the place when you're doing your grocery shopping. You can just kind of do whatever, take over the store. It is your domain. It was great. You make night shift work for you. Not even talking about the night shift piece, just a 3-day-a-week piece. I will tell you it's so great because when you work Monday through Friday and only work Monday through Friday, so you only have the weekends off, if you need to go grocery shopping, you want to go to Costco, you want to go get your car work done, you only have the weekend to do it. A lot of those places are closed, like car dealerships, dealerships. The service centers probably aren't open on the weekends or on Sundays as much. So you're fighting everybody who's in the same boat as you to go to the store, so the lines are bigger. It's harder to get your vehicle in. If you're trying to get appointments for doctor's appointments, dentist appointments, whatever, you're trying to deal with either taking a day off of work or trying to do a late one. So, want to get that, my dentist is open Thursdays until 8 once a month, so I have to make sure I sign up for that spot. When you only work 3 days a week and you're guaranteed to have at least two days a week off sometime in the middle of the week, you can get so much more accomplished with so much less hassle. Now, the downside is, besides the whole rotating thing, is weekends are not exempt from your working schedule. You do get another differential for the weekends depending on the facility that you're at. My facility offers a decent differential for the weekends, but that's part of the normal rotation. Keep in mind, hospitals don't close. Hospitals are open all the time. There's always patients. That means your weekends, that means your holidays. They need people there to work. So that's part of your normal schedule. And a lot of times in the scheduling, you are told you have to work so many weekends, so many weekend days in a schedule. So you had to work. In mine, I'm trying to remember what it was. I'll tell you, it's been a little bit since I've been a bedside nurse, but it was 6-week schedules. Half of your shifts had to be off shifts, and you had to have X number of weekend shifts in there. And I don't remember if it was 4 or 5 weekend shifts in there throughout that 6-week schedule. But there was a minimum number you had to meet. And we did what was called self-scheduling. They let you submit the hours and the days and the shifts that you wanted. And then it was still based on seniority on who got them, depending on what you requested. But if you requested this and there was enough spots for that, you got it. So self-scheduling was a thing. And I'll tell you, they were my facility is pretty good about giving you mostly what you asked for. Sometimes they didn't. A lot of times you could trade for it. But it was pretty easy to kind of get a day off if you needed to have a day off, and that you knew about it in advance. Like I knew I didn't need to work this day. I became an EMT and a firefighter, or shortly after I became a nurse. So within my first year of nursing, I was going to my EMT program. I ended up able to take a Monday through Friday EMT program that was 8 to 5 every single day. It was a 5-week crash course. They called it the Summer Crush is what they called it. So it was 5-week Summer Crush. Monday through Friday, 8 to 5 was this class. And what I did was I worked Friday night, Saturday night, Sunday night. I had it worked out with the scheduling team. They're non-desired shifts anyway, so they were more than willing to be like, sure, we'll put you on every Friday, Saturday, and Sunday night if that's what you want to do. It made it hard because I would leave class on Friday and go straight to the emergency department to go work a 12-hour night shift on Fridays. And on Sundays, I would work a 12-hour night shift and then go straight to class on Monday. And it was not as bad as you'd think it was to work or to go to a class during the day and then work at night. It was hella hard to be working Sunday night and then go sit and spend 8 hours in a classroom setting in the morning. That was hard. I sprinkled some vacation in there, some of my PTO days in there as well, so that made it a little bit easier. So I didn't work all 3 days every single weekend of that class. I did like that twice, I think, and then I sprinkled like a Friday off this week and a Sunday off this week. It was only 5 weeks, it wasn't much to do, but I was able to schedule myself that way. So it worked out very well. So the scheduling can be difficult to look at, and the lifestyle can be hard because you're doing night shifts or rotating and working weekends and working holidays. At the time, I was single, didn't have a family. It worked out well for me. It's harder for people with families, and I get it, but it's something that you need to know going into the profession, that is this something you're going to have to deal with, that you're going to have to work holidays, you're going to have to work weekends. Keep that in mind. So with the holiday pay, you have to watch out and know exactly what your contracts are, because the way our contracts were written is you have to work your schedule day before the holiday and day after the holiday in order to get paid for the holiday. I mean, it sounds fine and dandy, and the whole intent of it is to stop people from calling out on the day before if they had the holiday off to do an extended vacation, because they'll just call out one day and then have all these extra days off. If you do that, you will forfeit your holiday pay. The weird quirk of it is it's worded in such a way that we had one nurse when I was in my second year in the emergency department. She worked on the holiday. We worked together on a holiday. She got sick and called out the next day, which was her next scheduled shift after the holiday. They forfeited her holiday pay. They didn't pay her for it because technically she didn't meet the guideline. She worked on the holiday and still didn't get holiday pay. So just if you're in a place that has a union and you have a union contract, or just based on your hospital policy, check that and understand what you're doing before you run into a situation like that. Nursing profession itself and actually working as a nurse. Let's talk about the work. I will tell you, teamwork is key. Sometimes nursing can be a dog-eat-dog world. When I started in nursing, it really was a dog-eat-dog world. And I don't know why. There's no reason for it. But there were some people there who seemed like they wanted you to fail. Some of them seemed like that because they were trying to push you to be your best. Some of them seemed like that because it was like that. They really did want you to fail. We had a few of those. Teamwork is key. Just like I talked about studying for exams in nursing school, find people that you can work with and work with everybody. I'm not saying ignore everybody else. Always be a team player. I'll tell you, when I moved from the emergency department to the ICU, there was a lot more people who liked to do things solo. I don't know why, but they wouldn't be willing to help other people because they had to focus on their stuff. They just want to get their stuff done. I'm not going to help you. Be a team player. It's interesting because as a male nurse, for some reason, people assume that I am much stronger than everybody else. There are plenty of strong women that are in nursing. And I don't mean like, strong women like empowered. I mean strong women like strong women that are in nursing. And there could be people that are much larger than me. And I don't mean like bigger. I mean like bigger, more muscular people who work out every day, that they would ask me to help them do their turns and their lifts instead of the other stronger person there. I don't know why. It's some weird thing. But it helped me out in a lot of ways. I would be asked to come in and do turns and do lifts with people. I always told them yes, absolutely. Why? For one, I want to be a team player. I want to make sure everybody functions together. We work cohesively as a team. The better you work as a team, the better the whole morale of the department is, and the more fun working is. Working is great when you get along with people. Working is not as great when you don't get along with people. So try to work together as a team. And I will tell you, I never had a problem with people coming in to help me. If I needed help with the lift and I asked somebody, anybody would come help me. Whether it was because they also had the same teamwork mentality, or whether it was through obligation because they knew I helped them, so they were kind of obliged to help me, and they knew if they told me no, that I was no longer going to be as willing to go help them. So, whether it was because they really wanted to be a team player or whether they felt obligated to, it worked well for me to go help everybody else as much as I possibly could because I knew that they were there to help me when I needed it. But teamwork really is key in nursing. And you might just come out of a patient's room, whether you're in the ER, the ICU, and just be like, I don't understand something that's going on. Let me run it by you and see if you can help fill in the gaps on what I'm missing. Talk to the more experienced nurses, talk to the younger nurses, just somebody else who's experienced something before. Being a team player can be helpful in so many ways. Something people often ask about nursing is, but I don't want to do disgusting things. If I become a nurse, am I going to have to do disgusting things? Well, yeah, you are. If you're a nurse working in the hospital setting, yes, you're going to deal with disgusting things. You're going to have to clean up feces, blood, urine, vomit. It comes with the job territory. It is part of what you do. I was fearful that I would be a little grossed out on certain things. I, used to be the kid who, if the dog pooped in the house and I had to clean up the poop, it was just picking it up was like, it was gross and disgusting and it kind of made me queasy. That didn't really transfer over to the nursing world. It actually transferred over the other way. I did it because I had to. I say because I had to. You also want to, because when you're seeing people in the hospital, you're seeing them at their worst. Nobody wants to be in the hospital. Well, I can't say nobody, but the average person does not want to be in the hospital. They are there because they are at the worst moments of their life. That's why they have to come see you in the emergency department or if they're admitted to the hospital. Those people want help to keep their dignity, to keep their respect. They might be there because they're incontinent or some disease process makes them incontinent. They don't want to sit in their feces for a long time just because I think it's gross to clean it up. I want to go help them feel as dignified as they possibly can. Oh, you were incontinent again. Let's get that cleaned up, because I know if I was in the hospital, I don't want to sit in my for the rest of the day. It's just the way it is. You got to be respectful to your patients. Treat them with dignity. Treat them with respect. Though you're going to be dealing with gross things, there's going to be something that grosses everybody out a little bit more than it does somebody else. And when there's those things that happen, you might be able to solicit your friend. I had some people that they just putting down an NG tube to them was like the worst possible thing that they could do. It was just a gross act that they just didn't like. They couldn't do it. They weren't as successful with it. They hated it. It made them feel queasy. Some of those things, you can solicit help from one of your fellow colleagues to be like, hey, look, I'll go give your patient a bed bath. I'll go start your Foley. I'll go start your IV line. I'll go do something. If you will just come and please help me, please do the NG tube for me, because I really just don't think I can handle it right now. Sure, I don't mind putting in NG tubes. I actually kind of enjoyed it. I got pretty quote unquote good at it for what the procedure is. It can be a very destructive procedure to a person. You have to put an NG tube is putting a tube down their nose, down to their stomach. It can be pretty gross to do. It is not pretty for the patients, but if you can do it well and you can do it better than somebody else, it can be, one, more comfortable for the patient to do it, and two, why would I not want to go help somebody if they have this problem, that this is the one thing that they really can't do? Let me go help them out, because then they'll help me out with something that I really don't want to do. I personally don't like putting in Foleys. If you want to go put in my Foleys for me, that's the catheter that goes up into your bladder for your urine, so for those asking. But if somebody else is willing to do that for me because I don't like doing that, and I'll go do something for them that they don't like doing, but we're both good at the other one, yeah, why not? It's teamwork. On with more of the disgusting things. You will find out very quickly in the nursing profession that certain things have very distinctive smells. And this is nobody tells you before you go into nursing school, but certain things do have distinct smells. C. diff, for one, is something you can just smell and you know it's C. diff. That actually didn't gross me out that much. The C. diff smell wasn't as bad, but GI bleeds are the thing that oh my God, the smell to me is horrendous. And what that is, quick version of it is it's bleeding into the GI tract of some type, whether it's the upper GI bleeds and it's into your stomach, or if it's lower than that. Upper GI bleeds to me smell terrible because it's basically blood that's been sitting in your stomach and curdling and mixing with that stuff, and it has a distinct smell, and it's terrible, and it's something you have to get used to. I remember a story I went in to help a fellow nurse put in an NG tube, just like I was talking about before, in a patient that had a GI bleed. As we were starting to put it in, it triggered the gag reflex of the patient. The patient started coughing and basically projectile vomited blood from the stomach all over both of us, and it like covered our like faces, our scrubs. We had to go borrow scrubs from the OR where they have their clean scrubs that they keep, because we had to change, and I swear to God, I smelled that smell for like a week. I couldn't get it out of my nose. It smelled like it was just there in my nose the whole time. So yes, you're gonna have to deal with gross things in the nursing profession, and some of them have very distinct and disgusting smells. It does happen, so prepare for it. Another thing to know about the nursing profession is breaks. And sure, there's places where you're mandated a break. Like California has very strict laws. You have to have a 15-minute break by this time. You have to get your 30-minute lunch that has you're not interrupted during it at all at this time. The laws exist in certain states. The expectation exists everywhere, but the patients don't always cooperate. And that's not to say that they're doing it on purpose. You're there because people are in a bad situation, especially in the emergency department. I don't know what's walking through the door. You don't know how many times I was on my lunch, I'm eating, and all of a sudden somebody would be like, Jeff, your patient's crashing, or this is happening, you know. Granted, you have other people that are watching your patients, but things happen on a dime. Things change quickly, and you have to be prepared that you might go 6, 7, 8, 9 hours without being able to stop and grab a drink of water. It's not healthy, and you need to try to get that water as much as you can, but it happens more often than I like to admit, that I would realize it's been 9 hours and I haven't had a drink of water. My mouth is super dry. If I could make it to the bathroom, it is like a very dark color because I'm not hydrated enough, and I haven't eaten in that long. I've gone through multiple shifts without being able to eat because it's just been that busy. You try to work on that. You try to have your team help you out, get in there, assist you so that you can take a break. It doesn't always happen though. So it's just something you gotta watch out for. Try to plan your day accordingly. Try to help people out so that everybody can make sure they get their breaks. But keep in mind, it doesn't always happen. It is part of the profession, and it's sad to say because some people are gonna watch this video and be like, oh, that's terrible, that company. Yes, if you don't get your lunch, you're supposed to get paid for your lunch. I can mark up in a little book, I did not get my lunch today, and now they have it actually built into the time clock. I could say, nope, I did not get my uninterrupted lunch. I will get paid for that lunch. They don't want it to happen, but it does happen. And it's built into our time clocks now to accommodate for that because they know it's legally they have to pay you if you didn't get your lunch. And they're gonna track that. How often are people not getting their lunches? What do we have to do to change the staffing mix? But it's built in because it happens and you need to be able to get paid for it. So just know that it might happen. And some other things that you might want to understand before going into nursing, or if you're in nursing, that there is a concept that a lot of people neglect to tell you of: forced overtime. So the way overtime works in the nursing profession, usually, if you're working 3/12s and you pick up an extra shift, you have 12 extra hours that you're picking up normally. Like you can pick up an 8, but let's just keep it simple and say, I picked up one more day of the week, I'm gonna work a shift. I'm working a 12-hour shift. That is not 12 hours of overtime. That is 4 hours at regular pay because I've only worked 36 hours so far. So that first 4 hours of my shift is less than 40 hours. So that's still only 4 hours of regular pay. And then I'm getting 8 hours of overtime because that's what my over 40 is. I think this does depend on the hospital contract where you're at, or hospital policy, or the union contract or whatever. Some people will have it so it's just anything over your 36 could be overtime. That's not the way my facility is. But I always have to keep that in mind when I'm picking up an overtime shift, that all of it was not overtime. Also, some facilities have it so that if you work over 12, anything that you work over 12, if you were asked to stay or said you were willing to work 4 more hours and they were short-staffed, that would automatically be overtime pay. So 12, anything over 12 in a day is overtime, even if it's only adds me up to less than 40 hours of the week. That's not the way my facility worked. So I had to know if I worked over 12 hours. DC, state law, you can only work up to 16 hours in a row as a nurse. So I was only eligible to pick up 4 extra hours on top of my normal shift. But that 4 hours was not overtime unless it was over 40 hours. But there is a such thing as forced overtime. A hospital system has patients that they have to take care of. If people don't show up to work and there's not enough people to take care of those patients, they can obligate you to stay because it would be detrimental to patient health if you left. I know it sounds terrible and it's never happened to me that I actually had to stay over because nobody was there, but it is a thing you have to be aware of. There has been times though when the hospital can go into a state of emergency and bar you from leaving. We had some incidents in DC with some snowstorms. If the hospital declares a state of emergency during that snowstorm, you cannot leave the premises. Your shift ends, you have to stay. You get paid for that time that you stay if the hospital has declared a state of emergency, but you are not allowed to leave. They still can't have you officially working more than the maximum 16 hours in a row, but what they can do is make you stay, get you a bed and a place so that you are there, give you an 8-hour rest break, and bring you right on back, because patients need to be taken care of. So that's just something to know about the profession, that state of emergencies do exist and forced overtime does exist that might make you have to work more than what you're scheduled for. So just know that going into the profession that is a possibility. Speaking of mandatory time, in my hospital, you can only work a maximum of 60 hours in a week. It means if I was working 12s, that's picking up 2 extra days. So if I worked 3 days and decided to pick up 2 days of overtime, I can do that. I can pick up that extra 24 hours and have it be 5 days. The interesting thing about the way that it works is for some reason it's not based on a rolling 7-day calendar. It's based on the calendar or the scheduled week. So it's based on from Sunday to Saturday. But if I had my shifts, so I worked Wednesday, Thursday, Friday, Saturday, and I worked those 4 days, that's the end of 1 week, and I'm only working 4 days in that week. But I could have the next schedule start, and I work Sunday, Monday, Tuesday, Wednesday, Thursday even, because I'm going to pick up 2 overtime shifts that week. I could theoretically work, in total, I could work 10 days in a row, because that crossed a week threshold. I can work Tuesday straight through the 10 straight days and not be against that rule. So just be careful if you hear, oh, I can only work 60 hours, I can only work 5 shifts, so therefore it's my 6th shift in a row, I'm not obligated to go work that shift. That's not true. It could depend on the way your policies are written and where that falls. I don't agree with that per se, because the whole point of saying you can only work 60 hours in a week is to avoid burnout of working way too much and being too tired to actually deliver good care. But they don't really enforce it in the way it should be enforced to make sense in the way it needs to make sense. Just something to note. I think this video is going to turn out way longer than I anticipated it being. But moving on, what are some of the great things about being a nurse? Because I don't want to just sit here and talk to you about all the things that could potentially be bad about being a nurse. I love being a nurse. I completely enjoy what I do. I went into nursing because I wanted to help people. And though I don't do bedside nursing anymore, I am still part of the nursing profession, and I still do things that indirectly help the patients. Not directly anymore, but I really do miss the bedside. Nursing can be great on so many levels. Most facilities will offer some form of tuition reimbursement. The tuition reimbursement at my facility was fantastic because of the union contract. It's actually the only reason I went and got a master's degree in nursing informatics, is because I felt like I was giving away money by not taking advantage of the massive amounts of money that they would give you every year for tuition reimbursement. So if it wasn't for my facility and their tuition reimbursement, I wouldn't have the job that I have now, which is the Director of Nursing Informatics at my facility. I wouldn't have this job because I wouldn't have the master's degree in nursing informatics, because I would have had to pay for it and I didn't want to. I felt like I needed to do it because it was wasting money to me to not take advantage of it. So there are a lot of perks and a lot of career progression that can come out of nursing through the tuition reimbursement program or through other programs in general. Nursing is one of those great areas that you're not stuck doing the same thing all the time. If you get bored or start really hating or what you're doing currently, or get jaded in what you're doing, because people do get jaded in the nursing profession. It happens. Watch out for it. If you start feeling like it is no longer for you and what you want to do, you don't have to go through a new career path. You can move up into leadership. You could become a unit director. You could become a chart reviewer. You could become a regulatory subject matter expert. You could go into nursing informatics. You could go into nursing education. You can go work at the outpatient setting. You can go work for the government helping to make policies for nursing. There are so many things that you can do in the nursing profession that you don't need to go get a new degree to start over again. And there's not many people that can say that. A lot of people go out and get like a degree in, I don't know, say like economics. You can't take that economics degree and then just go put that to work at a car dealership. Maybe you can. I don't know how economics works. Maybe the car dealerships have a really big economics like background. I don't know. But there's less places that you can go and transfer to with an economics degree than you could with this nursing degree. Nursing opens up so many doors to people. So if you need something because you know you're the type of person who can't stay still in one place for very long, you have so many options. Speaking of just staying still in one place, if you want to travel nursing is a huge thing that exists out there. I know multiple nurses who've gone and done the travel nursing stints where they go to 12 weeks somewhere, and that's how they get their money. Not only because they get paid a hell of a lot of money for it, but because they like to travel. So they'll go spend 12 weeks in California. They'll go spend 12 weeks in New York. They'll go spend 12 plus weeks in Alaska or Hawaii on a travel nursing gig. There's very much opportunities for that way to travel and see different settings, basically on a company's dime. Like, you're not paying for your travel to these places. You're getting paid to go travel and go work and still have your 312s or 412s or whatever your contract happens to be, to have plenty of time to go see whatever place that you're in, travel, and just enjoy. Also, great things about gigs like that is if you're on a travel nursing gig and you decide that that contract ended, you don't want to take another one right away, you could take like a three month hiatus and just not work, have your money saved, and go take a vacation without having to request, PTO. Like, when you're a bedside nurse at a position somewhere, if you are like working for that hospital, it's harder to take like 3 months off. You can take what your PTO bank is off, and you got to get approval for long vacations and all, but it's a lot easier if you had one of those travel gigs. So that's just something for people to think about, is how many different places that you can move to in this profession. It's so expansive in the areas that it covers that it is a great profession for anybody who doesn't necessarily know what to settle down in one thing for the rest of their lives. You could settle down in quote unquote nursing for the rest of your life, but still be doing so many different things. Now, some tips for nurses. First, treat everyone with respect. This means your colleagues, your directors, your patients families. Treat everybody with respect. As I said earlier, people who are in the hospital are there at the lowest point of their life. Something is wrong that they need to go see help from a medical professional that may or may not lead to them being admitted as an inpatient. It may or may not be the end of their life. Treat everybody with respect. I have dealt with some of the most amazing people in my time as a nurse, some of the most amazing patients, some of the most amazing families, the kindest people I've ever met. I've also dealt with some of the worst people I have ever met. I've always tried to maintain that level of respect and dignity with everybody, and it goes a long way. And I'll even tell you, sometimes you'll meet that patient who is the worst person you've ever met on the first day that you're with them. But by treating them with respect and their family with respect, they grow to love you for the rest of the time you have to treat them. Obviously, this is more talking when you're at the bedside, not the ER. In the ER, you don't deal with them for nearly as long. Like when I was in the ICU, I remember this gentleman who came up. He was the biggest jerk I had ever met. Everybody he would yell at, scream at. Turned out it wasn't even like, it was him, but it wasn't him. He was a current hardcore smoker. He's now in the hospital. Nobody gave him any nicotine cessation. The first day I was taking care of him, he started screaming at me that all he wanted to do was go out and have a cigarette, and why wouldn't we let him go have a cigarette? Hey, people have their different vices, I get it. We talked to the doctor. Doctor said, oh, let's get him a nicotine patch. Like, let's get nicotine cessation started for this gentleman. He got that nicotine patch. Within an hour, he was like the nicest person you'd ever met. He was just going through such serious nicotine withdrawal, he didn't know how to vent. He'd not gone for more than an hour without a cigarette in probably the past 20 years of his life. And when he was forced to because he was in the hospital, he turned into the biggest jerk. Still, treating him with dignity and respect, got him what he needed, and he turned out to be such a nice guy, and he apologized to everybody. Once he calmed down, he was like, I am so sorry that I acted like this. It's completely wrong of me to do. So, like I said, the nicest guy. So you don't know what's going on with people. Just because they're treating you terribly doesn't mean it's because they're a jerk. You will deal with just genuine jerks in your time frame as a nurse, though. It does happen. It doesn't stop you from treating them with the respect that they deserve to be treated with. A note, it helps in a lot of situations, not just in nursing. It will help you in life to just have that mentality. Don't try as a nurse to go be the authority figure. I have seen so many nurses walk into a room in the ICU. Somebody's in the ICU, they're on a ventilator. It's, they're being kept unconscious or in a quote-unquote coma with drugs because that's part of their healing process, and they've got like 10 family members in the room. And I know it's excessive. You want to limit the family members because the medical professionals still have something that they need to do as well. But if they're not really in the way, I've seen so many nurses just walk in and be like, everybody out, 2 maximum, just do 2, everybody else out of here. And when you start an interaction with a family like that, they no longer look at you as a caring caregiver. You are just there to do a job is what it looks like. Go talk to people. Don't just go in and try to become the authority figure and take over the room. Talk to the family. Talk to the patient if you can talk to the patient, if they're able to be talked to. Talk to people about, okay, this is what we really need to do right now. We need to do some assessments. We need to give medications. This is the plan for the day. This is the plan for the day, plan for the stay. It's a big saying in the nursing area right now. Talk to them, set expectations on it. This time I need to, a lot of people to clear the room because we're gonna have to do this, but then other people can come back in and cycle. Just, don't be the authority figure. It sets a bad tone from the beginning. And I've seen nurses get into these big, not problems, but it makes the next couple days in their shifts, if they keep the same patients, it keeps that dynamic in a really weird way because the family really doesn't like the nurse because of the way they started the interaction, and therefore the nurse doesn't really like the family because they feel they should know better. They shouldn't have had that many people in the room in the first place. It just sets a bad dynamic, and I've seen that downfall people and make for bad shifts and bad care and just a bad overall cloud in the room the entire time. So just don't do that. And as I said before, another big tip in nursing, help your team. I've already gone over this earlier in the video, but help your team. Your team will help you. Help your team. It makes everything so much better. And the team isn't just your fellow nurses. The team includes the doctors, the techs, the unit secretary. Anybody who needs help, help them as much as you possibly can. They will be willing to help you. In doctors, dealing with doctors is a whole different thing to talk about in this video. And it's funny, I'll just leave it a small piece of dealing with doctors. Doctors aren't the know-it-all, overall scary, I'm better than you type of personality that a lot of people make them out to be in the medical field. Oh, trust me, you will deal with some that absolutely are. For the most part, the doctors are part of the team, and they care just as much about the nurses, the techs, the unit secretaries, the patients. They care as much about everybody else as they should. They absolutely are part of the team. There's a lot of really good doctors out there. There's also, like I said, some bad doctors out there who really do think they're better than everybody. But here's a little secret. There's a lot of nurses out there who think they're better than everybody and have the exact same attitude. That doesn't actually really come with a profession. It just comes with a personality. So people hear horror stories about working with the doctors. Oh, it's so terrible working with these doctors. The doctors just think they're better than us and don't listen to us. That is not true. That is not true. Yes, you're going to deal with it from time to time, but for the most part, they are so much more willing to work with everybody. In the ICU, especially the brand new people that get into the ICU, I will tell you, those new doctors doing the residencies or fellowships that show up in there, they look to the nurses. They look to the nurses for guidance because they're new. They don't know as much about the situation, these patients that you might have been dealing with. I've been a nurse for 5 years in an ICU setting. They're just coming in. It's their first time in an ICU. They're doing their first residency in there. They're going to look to the experienced professional and be like, what do you normally do in this case? Like, I know about this stuff in a textbook. I don't necessarily know about it like this. They are just as scared as everybody else is. So everybody is learning together. And doctors are great to work with. My wife is a doctor. I've never worked with her professionally. I've never worked with her as my doctor and the nurse. My wife is a doctor, though. She's obviously has a personality that's like mine. I couldn't get along with a doctor if they were all the way that I described, the way people think that they're all just better than everybody. That's not how it is. So just get that out of your head already. Everybody works great together. Tips for you if you ever become a patient. Treat everybody with respect. It's going to go back to the same thing. Treat people with respect and dignity is just one thing that should be a staple in everybody's life. Respect and dignity. It doesn't matter what situation you're in, who's the authority figure, who's not the authority figure. Respect and dignity goes a long, long way. But another tip for if you're ever a patient, bring food. I was always so happy. Some patients' families got really close to the nurses, and they would show up in the morning when they're coming to visit, their person, whoever they're there for. They would show up with like boxes of bagels for the nurses or whatever. It was the nicest gesture I'd ever have, and I love it. A lot of times nurses don't get the time to have a break. But when people bring food, bring a box of bagels, bring a little bag of candies, something, it is just such a sweet gesture to show that you look at everybody on the unit as like you're grateful that they are taking care of your family member. And it's not like, in a way, you can kind of think about it as, oh, you're bribing them to be nicer. It can go a long way with some of those people who are a little standoffish. They might go out of their way if you're going to bring them something. So some people are like that, but in general, it just means a lot to the staff. So if you have the opportunity, bring food to share for everybody. They will really respect you for it. They will love it, and it it goes a long way. Anyways, guys, this video turned way longer than I expected it to. Hopefully it was good information for you. If you have any questions about the nursing profession or anything I've gone through so far, put them in the comments below. I will try to answer as many things as I possibly can. As I said, I've been a nurse now for 10 years, just hit my 10-year anniversary, and it's my second career, so I have a lot of insight that I can offer to the profession, insight I can offer to prospective nurses, or just to people who are just curious about something. It's not their profession, but they're just intrigued by it and want to have like more information. So hopefully this helps somebody out there, and I look forward to meeting some of you new nurses on the line in the future.